the sixth webinar organized by the Advanced Laparoscopic Center and Hernia Clinics, Samarita Hospital. As a moderator, I am Dr. Shaun Shahriar. I am working as an assistant professor, Department of Hepatobiliary and Pancreatic Surgery, Shohid Sohrawardi Medical College. And our today's topic is research methodology for surgeons. And our speaker is Dr. Mohammad Abdullah Yusuf Sohel. He is working as an assistant professor, Department of Microbiology, National Institute of Neuroscience and Hospitals. Today, we have honored, learned panel of experts, all are legends in their fields. And we have, first of all, we have Dr. Shom Prakash Basu. He is the professor and chairman of General Surgery and Dean, International Affairs, professor in charge, Surgical Skills Center, All India Institute of Medical Science, Rishikesh, India. And we also have Professor ABM Jamal, professor and head, Department of Surgery, Dhaka Medical College. He is a legendary surgeon in our country, and he is very dedicated in medical education in our country. And we also have, last but not the least, Professor Pankaj Kumar Shahab. He is an advanced laparoscopic surgeon and founder, Advanced Laparoscopic Center and Hernia Clinic, Samarita Hospital, Dhaka. And he is ex-head of department, Shohid Sohrawardi Medical College. And he is one of the leading laparoscopic surgeon and has trained up many surgeons in the field of laparoscopic surgery and started Advanced Laparoscopic Center in Shohid Sohrawardi Medical College. So now we are here to start our session, and I am requesting Dr. Mohammad Abdullah Yusuf Sohel to start his presentation. Dr. Abdullah Yusuf.
Good evening, everybody. Thank you very much for giving me the scope opportunity. Here I am very much shaky about that. There are renowned professors are here. Thank you very much, Professor P.K. Shah sir, for giving me the opportunity to speak in front of this August gathering. So I want to start the presentation. I'm just sharing this slide, and everybody, can you see my slide?
Yes, we can see.
Okay,
you can
so
start.
Okay, now, so my topics is research methodology for surgeons. You know, this is a big topics, but I want to make it in concise form after discussing with the Professor P.K. Shah sir in several times, and he has guided me. What will be the topics of this session? The first is, what is research? Okay, then why do we perform research? How to perform research work? Then where to perform, how to plan a study design, how do we perform statistical analysis, how to interpret the result, and what are the limitations in doing the surgical research work. So first of all, what is research? Considering the research, research means the systematic method consisting of initiating the problem, formulating a hypothesis, collecting the facts or data, analyzing the facts, reaching certain conclusion, either in the form of solution towards the concerned problem or in certain generalization for some theoretical formulations. There is a huge number of sentences here, words are here. So what is research? Research, basically, we are doing the research work each and every time. From very beginning of our day life, we are doing the research work, like thinking whether we want to go to the office, thinking about that, is there any traffic in the road? So I want to go earlier. So this is also a research work. This is an type of hypothesis. Another thing is that housemaid are doing the rice in the cook. So in the rice, it is boiled. She just take one rice and say that the whole rice already boiled. So this is also a research work. So research work we are doing in each and everywhere. So this is the typical, the definition of a research. So what is the research methodology? It is a science of studying how research is done scientifically, or a way to systematically solve the research problem logically adopting various steps. So research methodology is a broad term, and we are doing lots of things considering the research work and the steps and systematic way. So this is the research methodology. Now, what are the types of health research? Health research there are several types. Like one is the lab research. It applies the knowledge of basic sciences. And the population based or field research, the research or study of distribution determinants, control measures, or health related phenomena in certain population. And the healthcare facility or clinical research, the research in the healthcare facilities, like a randomized control trial, that what we are doing in the hospital facilities. Okay, so these are the different types of health research that we are performing in different situation, different places, different scenarios. So what is the characteristics of a research? Research has a clearly stated question and a hypothesis. It has, the hypotheses are two types. One is the null hypothesis, another one is the alternative hypothesis. And research should have a specific plan of action. You cannot do anything without a specific plan. So you have to focus on a single plan, then you can do a research work. Build an existing knowledge. You want to build an existing knowledge, so you have to establish that. So you have to do the research work. So another thing is that generate new data which answers the original questions. New data you want to generate, so you want to answer the original question. So you have to do the research, and research characteristics is one of these. Then another is open horizons for further inquiries and research. This is also a characteristics of research. Now, what will be the subjects and data collection? Subjects will be the selected units, like individuals or groups. It may be individuals, individual patients, individual persons, or it may be a group of people or group of patients. That will be the selected units. Another one is what will be the study population. Study populations may be the cross-sectional type of population or longitudinal type of population. Then what will be the data collecting timing? It may be prospectively, retrospectively, or maybe the combined. This type of study design currently is going on. So another thing is that data collection types may be data, the primary data, it may be secondary data. In later slide, I will discuss about what is primary data and what is the secondary data. So regarding the study populations, when we consider the cross-sectional, the time, place, person will be in the same will be at the same time, place, and person. This is the cross-sectional. Like we are doing the research work, and in the same time we will doing the research work in the same place and in the same person. So these are the things of cross-sectional study. And what about the longitudinal study? Two or more sets of observation, like follow-up. Where there is a follow-up study, this is longitudinal study. And another is the dynamic. It is gain and losses of members in that study, where the gain and losses of members will be occurs in the study populations. So what is the difference between the cross-sectional and longitudinal study? In a direct point, I want to mention that in cross-sectional study, one point in time, in longitudinal study, several points of time. So when you will do the follow-up study, so you need to follow up some period of time. So that is the longitudinal study. In cross-sectional study, different samples. Longitudinal study, the same samples we have to take. Cross-sectional study, the snapshot of given point of time, change at a societal level, and longitudinal study, change in the individual level. In cross-sectional study, for example, British social attitude survey, labor force survey, or like we can do in our scenario that in a time frame, we can do the descriptive study, that is the cross-sectional study. In longitudinal study, British birth cohort study, or understanding the society. So any type of cohort study or any type of clinical trial, we have to do the follow-up. So that is the longitudinal study. Now, What about the data collection types? Previously, I have told that there is a primary and secondary data. So primary data is that investigator first to collect the data. That is the primary data. And what are the sources? Sources are the medical examination, interview, observation, like that. Okay. And what is the merits of this primary data? Primary data, less measurement error, source objectives of the study better, and disadvantage, it is costly, may not be feasible. So these are the characteristics of primary data. What about the secondary data? Secondary data collected by others for other purposes. So sources like individual records like medical or employment record or group record, census data, vital statistics, these are the secondary data. Sometimes these data have some lack of variables, so difficult to do the research work. So it is better to collect the primary data. Secondary data has some limitations. Then what are the sources of data collection? There are routine system. We know the vital statistics like birth and deaths, health insurance, communicable diseases. These are the routine systems that we are, these are the sources of data collection. And a survey, it may be interview, telephone, through telephone we can do the research work, and through email or self-administer. We just give the self-administered questionnaire to the respondent and say that just fill up that questionnaire and send to me. So that is also a self-administered survey. So another thing is that another sources of data collections are the disease registry like hospital and community based, and sentinel event recording system like health, disease and health services. Though these are the sources of data collection, we can collect the data from here. Now, the very important thing is that when we want to do the research work, we have to plan a study or plan a research work. So this is study design. So study design is specific plan or protocol for conducting the study, which allows the investigator to translate the conceptual hypothesis into an operational one. So it is most important, most crucial for doing a research work. Otherwise, we cannot do the ultimate analysis and cannot find out the hypothesis or cannot find out the answer. So when we want to do a research work, first you have to plan accurately to make a study design clearly. If it is clearly defined, sorry, then we can do a research work, and furthermore we can do the statistical analysis and we can get a better result. Otherwise, in the international level journal, it will be rejected just for the flaws study design and the flaws statistical test. So when we do the research work, we first have to do the study design correctly. Then what are the study design are there? There are two basic types. One is the qualitative research, another one is the quantitative research. So, sorry. In quantitative research, it may be observational and experimental. So in the later slide, I will discuss briefly in the different study types. So in the qualitative research, we just ask the patient qualitatively. So there will be no that type of questions there where the questionnaire that contains the yes, no, or present, absent, like that. It is open questionnaire. So this is the qualitative research work. In the quantitative research work, it is closed systems. The participant or respondent, the subjects or the patient cannot give their own feelings or own like that. We have closed this questionnaire. So this is the quantitative research work. In the quantitative research work is the observational and experimental. So in the observational design, what we are doing studies that do not involve any intervention or experiment. That is the observational study. Just watch the patient, record the different variables, different data, and that is the observational study design. And what about the experimental design? Studies that have manipulation of study factor like exposure and randomization of subjects to treatment, that is exposure group. So we have to, if we manipulate or do any intervention, that is the experimental design. So basic thing is that observational study, just observe the patient and doing the research work. In the experimental design, doing the intervention and just observe further outcome of the study. So this is the experimental design. Then observational design have many other classifications like exploratory, descriptive, analytic. So exploratory used when the state of knowledge about the phenomena is poor, small scale or limited duration. This is exploratory observational design. And another one is the descriptive study used to formulate hypothesis is small and large scale. Examples are case studies, cross sectionals like that. Another thing is that analytical study used to test hypothesis small and large scale. So it is the case control study, analytical cross-sectional study. Important one thing is that cohort study. So these are the analytical type of study where we just do the statistical analysis. In the descriptive design and exploratory design, we cannot do the statistical analysis. So when there is the analysis, this is analytical test, analytical type of study design. And those, what are those? The case control, cross-sectional analytic, and the cohort design. Okay. So in the later slide, I will discuss all these things. In the cross-sectional study, we take the sample, representative sample from the study population, and we just search the exposed and non-exposed group, find out the disease and no disease. So then we can compare these two groups. This is simply an analytical cross-sectional study. Okay, so we can do this analytical cross-sectional study in this way, and we can do the statistical analysis as well by comparing these two groups, exposed and not exposed group. What about the case control study? Case control study, you can see these two groups. One is the group of interest, another one is the comparison group. So group of interest is the case group, and comparison or non-patient group is the control group. So just find out, taking the history, find out different variables and compare with those variables and draw a conclusion. That is the case control study. So from case control study, we can get information retrospectively, go to the retrospectively and find out the different variables, different risk factors. So case control study usually done to find out the risk factors of the patient. So case control study, it is always retrospective study. Okay, so we should remember about this design of the case control study. What about the cohort study? As we know, cohort is a follow-up study. So we just take the two groups, that is two cohort, and one cohort or one group will smoker, another group is non-smoker. We just follow up over a time of period, and we will find out that which group in both group, what are the exposed and what is the outcome of those two groups, and then those outcomes we will compare. So cohort study, it is follow-up study, and it is prospective in design, but sometimes we can do the retrospective cohort as well. Like we want to find out the carcinoma or cancer state in the Vietnamese population after 40 to 60 years later, when napalm bomb has been dropped in the Vietnam by the US. So you have to collect the data before the drop of the napalm bomb in that area, and then compare the data with the same people in that area collecting today, whether there is any cancer or like that, any type of things happen or not. Then this is called retrospective cohort design. So we want to go back and then come forward. This is retrospective cohort. I can give a very simple example in this way. In the hospital settings, Professor P.K. Shah sir has done lots of surgeries in the Sorority Hospital, and he has just he has done, just put all the records of the patient in the database in his department. After 20 years, one of his student has want to do the cohort study, whether those patients that the surgeries has been done 10 to 15 years back, how they are right now. So collect those data from the database of Professor P.K. Shah sir database and doing the research work today. So this is called retrospective cohort, and that researcher will follow up sequentially and find out the different type of outcomes and compare with them. So this is cohort study. So cohort study is a follow-up study. So you can see here the past, present, and future. Always the cross-sectional study will be the present. Okay, present situation, present scenario will be focused on the cross-sectional study. In case of case control study, you just go to the past, that is the retrospectively, and go to the past and find out the different variables and doing such type of research. And usually we are doing this type of study when there is a rare case, and we or then less number of cases we will found. When we will found, then we will do the case control study. And what about the cohort study? From present we want to go to the future. This is called cohort study, where there is a follow-up observational design. It is always cohort. Where there is a follow-up, this is cohort, unless otherwise intervention. If you intervene something, then it is the interventional study. But without intervention, if you do the follow-up, this is cohort. So what about the experimental design, the interventional studies? There are three broad heading types. One is the lab experiment, another one is the randomized clinical trial, another one is the community intervention study. So merits are the control of confounders. We can find out all the confounders, and we can do this type of experimental design as well. There are some limitations of experimental studies: limited generalizability, possibility of unethical randomization, impracticability under some settings. So there is some limitations of the experimental study. I will later on I will show the all the limitations of experimental studies in the surgeries as well. So what were the main three criteria of the randomized control trial? It is one of the topmost study design, and there are three things we should remember: that randomized control trial should have randomization, control, and as well as intervention. So these three criteria should have in the RCT. Otherwise, RCT or randomized control trial will not be fulfill the criteria, and there will be a great flaws. So there will be a control group, there should be a randomization, or there should be an intervention. So here is the diagrammatically showing the study design of RCT. So we will collect the sample from the study population. From the population, we will collect the sample, and the sample will be randomized into two groups, group 1 and group 2 equally, or maybe 1:1 to 1:4. Okay, so then new treatment will be given in the group 1, or the study group, or intervention group, and another group is the group 2 in the control treatment. So both outcome of these two groups will be compared, and the statistical test will be done to find out whether there is a significant changes or not. So after doing this test, we can say that okay, this new test is new treatment is fine, then better than the previous one. Here is another diagram showing clearly about the RCT, randomized control trial. There is a study population. We just randomize into two groups: intervention group, control group. Randomization can be done in simple random sampling method. You can generate, or you can find out this number from the Stata software or SPSS, or simply from the go to the Google, find out the random number calculator, then you can do the randomization sorry, very easily. So it is very simple thing to find out the randomization, randomization, doing the randomization and find out the random number. You can make it 2 or 3 groups, doesn't matter. So you can do this easily. So when you do the intervention, you find out the outcome of these 2 groups, and you just compare after follow up those patients. Okay. So clinical research work, you can divide it into broad 2 headings: no intervention, intervention. If there is no intervention, it is observational. And then comparison group, yes or no. If it is comparison group, then analytical study, that is case control, cohort, or cross-sectional, analytical cross-sectional. And if there is no comparison group, it is simply descriptive study. In intervention group, it is experimental design. And if there is random allocation is present, this is randomized control trial. And if there is no random allocation is present, that is non-randomization. So these are the clinical research design, basic design. So you just get some idea from here. Here there is another things that elaborately discussed here. So there are many things, many flaws, many questions, many different different things that give the study design more strong, or simply you just, if you mistake any sorts of things, then just all whole the study become flaws. So when doing a research design or study design, you should be cautious about that. One of my colleague has collected more than 300 data of arsenicosis in the community level. Huge data, it's excellent data, but due to the flaws of the study design, the whole data just dumping in the garbage. So when you want to plan a study design, is a must, or it is a mandatory for doing a research work. And many things like pragmatic RCT is there, single cohort are there. So many things we can discuss in another session, but right now I just skip from here as because more slides are there. So what is the most important study design, or which study design has most value? So in the base, it is the simply case studies, case series, animal studies, this type of things, opinion, editorial perspectives. These are the less common. Okay, then higher in the hierarchy, above all this is the case control study. Above this cohort study, most important is the randomized controls trial. If it is double blinded, then it is no doubt it is the strongest than any studies. Nowadays there are systematic review and meta-analysis. These are the things which are most interesting. Worldwide there are several systematic review and meta-analysis are performed. So we can do also this systematic review meta-analysis, which is the topmost in the hierarchy of this all these studies. So currently another study design is that review of this systematic review. So another and you can get it in some software where you can find out this type of, or program where you can do this type of research work. Review of the systematic reviews. So several systematic reviews have been performed in different countries. You just collect all those systematic review and you do a review work accordingly, taking all of these systematic reviews. So systematic review meta-analysis, as you know, the qualitative analysis of different research work is the systematic review, and the statistical method is the meta-analysis. So it is a very simple thing, but it is very hard to do. There are several processes are there. So and that can be a different session discussing on systematic review and meta-analysis. So randomization, it is a very important thing. Randomization is a simple random sampling method. Every person, every patient has equal chance to select as the study people or study or sample. So randomization can be done in different way, as I have already mentioned in previous slides. So there are several types of RCTs where we can find out the superiority trials or non-inferiority trials, equivalence trial, or cluster randomized trial, crossover trial. So these are the things of different types of RCTs we can perform. You can just superiority trials, you can compare with the two different types of surgical methods and just compare them, whether which one is superior or which one is not superior. So you just compare superiority trial, non-inferiority trial like that, and equivalence trial, whether these are both are equal or not, cluster randomized trial. So there are different types of RCTs we can perform and find out the different results. So in the surgery, there are three types of RCTs commonly described, and type 1, 2, 3. Type 1 in type 1 RCT, the comparison of medical treatment in surgical patients, that is the traditional clinical trial. Type 2, comparison of surgical technique with medical treatment or no treatment. And type 3 is the comparison of two surgical techniques. So these are the three types of RCTs performing in the surgery or surgical operations or surgical research work. So during research work, study design should be properly choose, otherwise it will give a flaws result. So the study design basically depends on the research question. What is the research question, or what is the research goal, the researcher beliefs and values, researcher skills, times and fund as well. If there is a small amount of fund, then you can do within a short period of time. So you want to do avoid the follow-up studies. So there are many things you can the study design will depend. Okay, status of the existent knowledge, occurrence of disease, duration of latent period, nature and availability of information, then available resources, time constraint. All these things will give you the clues about the choose of study design. Then what is the process of doing the research work? There are several steps, and you have to follow those steps. Otherwise, if you miss any step, then there will be a flaws in the research work. So when you will do or perform a research work, you have to first selection and formulation of research problem. That is the most crucial thing. So you have to formulate the research problem. Then literature survey, it is one of the important issue. Development of working hypothesis, research design previously that I have mentioned, sampling strategy or sample design, then pilot study, data collection, processing and analysis of data, testing hypothesis, interpretation and generalization, preparation of the report. So up to preparation of the report and published it, this is the process of research work. So when you will perform a research work, you should publish the research work. Otherwise, if you don't disseminate those research work, then nobody knows what you are already performed. So you must disseminate or publish the research work as an article. There are important issues in research, that is ethics of research. So we should follow those ethics. Otherwise, there are several things that can happen, and the one of the important issue is plagiarism, then claiming credit for results of others, misreport sources or invent results, data with questionable accuracy, concealing the objections that cannot be rebutted, caricaturing or distorting opposing views, destroy or conceal sources, data important for those who follow. So these are the things which should be follow during the research work. These are the ethics issue, and this ethics issue have been there are several agencies who follow these things, and in Bangladesh, BMRC is topmost ethics committee who just follow these things, and you just submit the research protocol here, and they can permit you, grant you, and all the ethics issue they can solve. Another important worldwide, it is the clinicaltrials.gov. It is the USA based, and you can find out several studies from here. And you just, if you submit any article, you just submit any proposal, research proposal, they can solve the ethical issues and give you the trial number. And if you get that trial number, you can submit any type of research work as an article or publication in the renowned journal like New England Journal of Medicine, Lancet, like that. Okay, so these are the clinicaltrial.govs. In India, National Ethics Committee, it is that type of ethics committee. They just give the ethics related issues, deliver the ethics related issues of any research work related to the biomedical and health research. So there are some local ethics committee in individual institution. It may be institutional review board or ethics review board. Even there are, when you will perform any animal study, there are some ethical issues. So we should follow all these ethical issues, and we should follow and doing according to the ethical issues of those according to that institutional review boards, committees comment or suggestions like that. Why do we perform research? That is the big issue. So we should do research work to develop new surgical technique. You want to develop a new surgical technique, just you have to compare previous one, old one, and just say that new technique is better than the old one. So when you have to develop a new surgical techniques, you should do the research work. Another thing is to reduce the mortality and morbidity in surgical operations. If you doing any research work and say that this type of surgical technique, if we apply, the morbidity and mortality will be reduced. So you have to do the research work considering these issues. Another thing is to get the respectability, to face a challenge, to solve a problem, to get intellectual joy, to serve society, to get a degree. So there are several regions we can perform the research work. To get intellectual joy, it is very important thing. If we perform a research work, there will be a feelings that I have done something, and I can disseminate those things to our juniors or senior colleagues. So it will be a great feelings when you have published a paper in the great impact journals as well. So we should always remember that the research work should be performed always in every places. Then what is hypothesis? Always I have previously I have said that we should generate hypothesis before doing a research work. So what is hypothesis? It is a statement or explanation of the relationship between two or more variables. That is the hypothesis. Very simple things. If we want to do a research work, you have to plan, or you have to write down the hypothesis of the research works. Unless otherwise develop a hypothesis, you cannot do the research work. So it is very essential to develop a hypothesis. So where there is an statistical analysis, you have to develop the hypothesis. Where there is no statistical analysis, you have to do the research question. So these are the important things you should remember. We should remember. So how to perform research? Need hypothesis formulation from literature search, then natural experiments, multinational comparison, descriptive studies, and creativity. So these are the ways we can formulate a hypothesis. Sometimes we just blank. What type of hypothesis I can do? From where I can get the clues? From where I can get the information? So you just go to the literature search. Literature search is the most crucial thing you can do anywhere, as because you have the smartphone, so you can go to the website and find out the different literature related to a research work. So one of the most important area is the PubMed search by specific keywords, and go to the PubMed and go to the advanced search area. There are some Boolean words and or not, and in this way you can search, and that can be another session how to search the research articles. So I just skip those things. And another search engine is the Google Scholar. It is one of the important scientific search engine, and you can get many articles from Google Scholar, and most of the publishers are going to give the free of cost articles in the Google Scholar. So you can go through the Google Scholar. So which one is better, PubMed or Google Scholar? So here is the Google Scholar. You can see in the left side there, you can select the time frame. So in the custom range, you can just fix up the time range. I want to all the articles from 2010 to 2020. So you will get all the results within this time period. So Google Scholar give you the very important clues of the articles, and all these are peer reviewed, published in the peer reviewed journal. So I think Google Scholar is better, as because if you search different articles of Bangladeshi people, you cannot get the that articles in the PubMed, as because we have only one journal, Bangladeshi medical journal, that is indexed in PubMed, that is the Mamashi Medical College Journal. So if you want to find out any article related to the Bangladeshi population, you cannot get in the PubMed. PubMed only give the articles that are those journals, they are indexed in the PubMed. The journals which are not indexed in the PubMed, the search in PubMed search engine will give you will not give you the article. So in this Google Scholar, you will get the index in the PubMed, non-index in the PubMed, whatever the peer-reviewed journal that has the ISSN number, you will find the Google Scholar will give you this result. So I think Google Scholar is better than PubMed as a search engine or for the literature search. In case of natural experiment, new observation by the researcher, some of the researcher has said that, or surgeon has said that, I have, my observation is that this type of operation give a better result outcome. So you can just give you just establish or develop an hypothesis and do the research work. Effectiveness of new surgical intervention, you just develop a hypothesis and then do the research work. Rare surgical cases, to compare old technique with new ones. This is working for last 5 to 10 years or 15 years. We have senior professors here, and they have huge experience in their life, so from their experience, they can easily develop a hypothesis and doing the research work later on. So in multinational comparison, you can develop a hypothesis as well to compare with the other countries' scenario, to work together with ongoing project of other countries for developing highly equipped facilities, to develop world-class facilities in our resource poor settings, to build up modern operative setup. All these things we can do in multinational comparison study. In descriptive study, we can generate hypothesis. So we should publish the descriptive study. What is descriptive study? I have previously mentioned that the 1 year, 2 year data just published in the journal, that is the descriptive study. Like, what is that? Just give the variables, age, sex, what is the presentation, and what is the disease, and what are the outcomes. So these are the things you just published in the article, and these will give the generate the hypothesis. A researcher can generate the hypothesis from this descriptive study. Gives clue for research essential for baseline study, can give a group of things, we can generate the hypothesis. Now, where we can perform the research work in any settings, either in the IPD or in the OPD settings and operative facilities area, we can also perform even in the primary healthcare facilities, for example, infection rate in circumcision and rural settings. So any type of, you can generate hypothesis and perform the research work in any places. No need to come to the higher centers and we'll do. If you want to do a sophisticated surgical work, then you need to or you must go to the higher center to perform those things or perform those research work. So how to plan a design? Several types of study design need proper knowledge about the study design that I have already previously mentioned, and this is essential for statistical analysis as well for inference. So previously I have mentioned the different types of study design, so I want to skip those things. Next is how do we perform statistical analysis. During performing the statistical analysis, we should know about the statistical test. Okay, which test will perform in which type of study design. So this is the most crucial thing. It is not it will be a flaws if we do all type of research, all type of statistical test in every study design. So it will be give the flaws result. So we should know about the parametric test, name of the parametric test, non-parametric test, what are the variables. We should perform the survival analysis. Survival analysis should be done in those settings where RCT design has been completed, follow-up study has been completed, different time period, what is the outcome of the patient, that is the survival. We should do the survival analysis. There are several things: Kaplan-Meier analysis, log rank test, Cox proportion hazard ratio. So we can do several tests from the survival analysis. So time to events, any type of time to events analysis or follow-up study, we should do the survival analysis. Then another thing is the regression analysis. It is one of the tough most analysis, and generalized, and there are several other things, statistical tests, generalized linear model or some other thing, factor analysis. I don't want to go all those things, and just give a brief about the statistical analysis. So how to interpret the result? We should know the p-value, odd ratio, hazard ratio, and also difference between the clinical and statistical difference. So sometimes we just find out the changes in the clinical parameter, but when we perform the statistical test, it doesn't show the p-value more than 0.05. So this gives the things that there is a clinical significance, but statistical significance is not found. So when we perform a study or research work, if there is any clinical significance, that also, but there is no statistical significance, that doesn't mean this study is a bad things, or these things is not good. It is not like that. Any negative result can give you the clues why this happened or like that. So we should perform research work, not for always to find out the statistically significant p-value. It may be performed without the non-significant p-value. So here is the clinical trial and surgical trial. I'm just showing here the picture, and just give a brief about the surgical intervention, that is surgical trials and the clinical trials, the drugs, that is different type of drug trial. So these are the things we can compare. And what are the challenges of surgical trials? That is the most crucial nowadays. So just concentrate in this, or focused in these slides very carefully. One thing is that clinical trials do not risk any differential skills during intervention. So clinical trial doesn't have any that type of challenge, but in case of surgical trials require skills and training to administer the intervention. This is the most important thing. In surgery is skilled and multi-step processes, and this make the design of the surgical trials challenging for the following regions. So we should know the things, that there are several challenges for the surgical trials. So it is very much difficult to perform surgical trials other than clinical trial. There are several ethical issues are there. So and there is a Helsinki declaration, as you know, all study subjects have the right to withdraw from the study at any time without prejudice. But this hardly possible in surgical trials. A patient is under operation and said that I will not do the surgical, or I will not do the surgical trial, or I will not participate in the surgical trial. So if you can't say in this way, you cannot withdraw yourself from the surgical trials. But in case of clinical trial, you can do that. In drug trials, another thing, in drug trials, most likely the drug company is responsible in case of an adverse event or bad outcomes. But in surgical trials, surgeons personally and legally are responsible for their patient. This is the most crucial thing. So huge ethical issues come out when you will do the surgical research work. So it is very much crucial, or you must cautious when you will perform the surgical trials. Important thing is that differential bias. There are several biases that there, like selection bias or Bergsonian bias, and there is a differential bias occurs in case of surgical trials. What are those? Training and experience need to develop a expertise in the surgical technique. So even for a fully trained surgeon, there is a learning process to become an expert with a new technique. So one surgeon cannot develop his or himself or herself that I am experienced one. Experience is coming, or development is a continuous process. So expert himself or herself, it needs a long time. So if surgeon is performing both new and standard technique, has limited experiences with the new one, and the results will be biased towards the standard technique. So these essential biases that can occur in the surgical trials or surgical intervention studies. So you should cautious about that, and these things will give you the flaws result or deviation of the result. So expertise-based RCT is very essential for these regions, and patients are randomized to surgeon who is expert in that intervention. Surgeons will perform only the procedure in which they have expertise. And procedural crossovers are less likely to occur because surgeons are doing the procedure in which they are most comfortable with. So there is expertise-based RCTs can occur. and this will give you the flawless results. Another thing is the surgeon's skill variation. There is an inherent variation in performing a specific procedure by different experts. There is also the effects of trainees, fellows, and others in the operating room, as you know, so they can help or assist the different variations of the surgical operations. It requires more sophisticated statistical analysis to adjust for the effect of surgeon's skill variation in multi-center surgical trials. So this can also minimize after doing this different type of statistical analysis, and these are the sophisticated statistical analysis, not so easy to perform. Another thing is that blinding in the surgical trials. Clinical trials traditionally double blinded. Patients and investigators are blinded to type of the treatment. But what about the surgical trials? Surgeons cannot be blinded. Okay, it is hard and unethical not to tell the patient that I am going to perform this type of surgical operations. If you agree or not, or if you want to do this surgical test, this is very unethical or hard to not to tell the patients about all these things. Blinded trials are not possible when comparing this surgical and non-surgical treatment. This is the crucial one. So if we do not blind it, then there will be a selection bias, or there may be a flaws in the analysis or research work. So what we can do, we can blind it the outcome assessors, okay, or we can blind it the data analysis. As we know, there are three types of blinding, that is single blind, double blind, triple blind. So single blind, patient do not know what is the treatment. Double blind, patient and researcher do not know what is the treatment. And triple blind, patient do not know, the researcher do not know, as well as the data analysis do not know, data analysts do not know what is the treatment group and what is the control group. So we can blind it the outcome assessors and also the data analysis, we can blind it in this way in the surgical trials. So outcome assessment, we can patients knowledge of the procedure often influence their behavior. This is how thorn effects. This is very much important or crucial things. If I know that this type of procedure give me the better results, so the result outcome will be deviated. Again, one thing is the investigator's knowledge of the procedure influence the assessment of the outcome. This is another thing that can happen. So co-intervention, it is another thing the patient often require. There may be an outcome assessment where there is maybe a flaws can occurs. Okay. So what about the follow-up time? It is hard to determine the appropriate duration of follow-up in surgical trials. Loss to follow-up is higher when the duration of follow-up is very long, or when no treatment is required after surgery. Sorry. So this can give you the loss to follow-up. But remember, when you will perform the survival analysis, you can include all these loss to follow-up patient, dead patient. Never ever just cut out those patients from your data set. Okay, please remember this. With all these patients, that is dead patient, loss to follow-up patient, you will do the intention to treat analysis and included all those patient, and you can do the Kaplan-Meier analysis. So remember, when you perform any type of follow-up study, you just keep up all these patients and do the final analysis. There are some component of health research proposal, that is executive summary, literature review, rationally objective hypothesis, methodology. There are some different organization give the different performer. Just follow those performer and can give a good proposal. So there should be some criteria for good proposal as well. That is credible, innovative research question should be there. Meticulously designed research plan, carefully selected research team, attractively presenting all of the above so that communicates clearly and concisely, follow a logical outline, indicates merits and limitations of the plan. So this is the most crucial thing during performing a research work. Research methodology, huge things, lots of things we can say, we can discuss in these issues. but I try to make it in a concise way and try to give you the view of research work and give you the how we can perform the research work and how we can plan the research work. So this is all about my today's presentations. Thank you very much, everybody. Thank you, sir.
Thank you, Dr. Mohammad Abdullah Yusuf, for your brilliant and clear, detailed presentation. I think all of the participants has gained some knowledge from your lecture. And our today's scientific partners are SCA Pharmaceuticals and Raj TV. I am on behalf of organizing committee, I am thanking them. And we have two questions from the participants. One is from Tanvir Chaudhuri, Assistant Professor of Pediatric Surgery. He has asked, do predatory journals have ISSN numbers? Is it, it's
yes, yes. Actually, there are some authority who just find out which are the predatory journal. What is predatory journal? These journals are find out the articles of different researchers in the low income country and said that I can publish this article, but they have taken large amounts of money. But those journals are not that type of standard. Even they don't have the DOI number. Digital object identifier, those are taken from the Crossref authority. And even you cannot find out those articles in the Google Scholar as well. So these are the predator journals, and we should avoid those predator journal as well. But when these predator journals apply in the ISSN in the France, in that authority, they follow the mainly 2 or 3 things. Okay, whether this is peer-reviewed journal, they just give the ISSN number. Whether they have the editorial board, whether they have any from any organization or publishers, they are giving the ISSN number. So ISSN number doesn't indicate whether this is a predator journals or not. Thank you.
Thank you, Dr. Yusuf. And there is another question from Dr. Kazi Alam. What is open arm and what is closed arm RCTs?
Open arm and closed arm is that when you will perform the RCT, randomized control trial, you just take the patient randomly from study group and control group, or treatment group and control group. So you just close the system from very beginning. This is the closed arm. No patient will enter here. And in open arm, this is not follow as well. Thank you.
Thank you, Dr. Yusuf. We have here a good number of senior faculties of the country and who are the legendary of their field. I would like to hear some words from them. At first, I'm gonna invite Professor Moti Rahman sir, who is a legendary surgeon in many fields of surgery and one of the most senior surgeons of the country. Professor Moti Rahman sir, please say a few words, sir.
Thank you very much. I've enjoyed thoroughly this lecture, and I think this will be an eye opener for our young surgeons, and I hope this part of the research work was neglected by us, and our young colleagues, they will take it up and will advance in this research project and the research work. I congratulate you for organizing such a seminar, and I hope and wish to hear from you, and in this context hereafter. Thank you very much. Thank you.
Thank you, sir. Thank you, sir. I would like to next invite Professor Shafkat Hossain Khandukar, our eminent plastic surgeon of our nation. Professor Shafkat sir, do you hear me, sir? Possibly Shafkat sir has left. Okay, we have here Professor Firoz Kader, sir. Sir, can you hear me, sir? Sorry, learned audience. Possibly Safkat sir has also left. So we have. I would like to go to Professor Mustafizur Rahman sir. He is the head of the Department of Shoiswaradi Medical College. I would like to hear from him about this presentation and program. Sir, unmute yourself, sir. We can't hear
thank
you.
Yes, can you follow me?
Yes, sir.
Thank you, Dr. Shahan Sharia, for giving me the opportunity to say something in front of this learned audience. First of all, I must congratulate Dr. Abdullah Yusuf. Very elaborate and nice presentation. I have learned a lot from his presentation. He was, once upon a time, he was in our Shoiswaradi Medical College. And most of the journal he edited by Dr. Abdullah Yusuf. Also, in present time, also we sometimes we communicate with him when we feel difficulties. So very for our clinician, the research work, we do a lot of work, but we cannot present in the research form or in the article form. So this today's topic, the organizer, I must thanks the organizer to select this type of presentation, because in COVID time we are observing the most of the clinical presentation, COVID and surgical presentation, but this type of presentation is very rare. So that I think all of us learned a lot and benefited from this presentation, and they will encourage to do the research work, because most of the time for difficulties we will a bit lazy for presentation. And I think the expert panelists, my very favorite Jamal Bhai, and my teacher in medical education, I think this type of session further we should arrange. I must thank to the organizer, especially P.K. Shah sir, and expert panelists and my senior teacher. Thank you very much.
Thank you, sir. Next, we have eminent colorectal surgeon, Professor Shahadat Hussain Sheikh. Sir, please say a few words regarding today's presentation. Sir, are you here?
Yes, Sean.
Thank you, sir.
Thanks for your kind introduction. And actually, most of the time, this lecture on the research methodology, I never felt attractive. But this lecture by Abdullah Yusuf is a wonderful lecture. I felt really attraction, and I just, not only that, I took a lot of photographs from his presentation, different slides. So congratulations for the wonderful lecture. And I learned something. I learned many things, in fact. And as usual, probably within few days, I will forget many things. So that I have taken some photographs. I will review all these things. And thank you very much for organizing such a good thing. I think for the teacher and who are guide of the, whatever we say, thesis or dissertation, we should learn, we should know at least basic thing of the dissertation and thesis protocol and everything. Thank you very much.
Thank you, sir. You will be getting the video link, so you can review the lecture again and again if you forget it.
Okay, that I understood later on.
Yes, sir. Yes, we will provide the live telecast and video links, sir. Raj TV is recording this one. And now I would like to invite Professor Brigadier General Shohid. Sir, are you here? We'd like to hear from you. Sorry, possibly he also left. Now we have here Professor Dr. Muttaleb Hussain, sir. Sir, can you hear me? Yes, we can see you, sir. Please unmute your microphone, sir. Sir, please unmute yourself, sir. Sir, we can't hear you. Unmute yourself. Yes, thank you, sir.
Thank you. Thank you, Shaun.
Thanks.
I am very
Welcome,
much
sir.
delighted to say something regarding this kind of program. Usually we clinicians are very much acquainted with the clinical lecture and clinical presentations, but such kind of presentation is very much useful for the junior doctors, especially surgeons. Thank you very much. Thank you.
Thank you, sir. We had few more senior professors and teachers who are not with us at this moment. I can't find them. So I would like to go to the panel of experts. At first, I would like to hear from Professor ABM Jamal, Head of the Department of Surgery, Dhaka Medical College. Jamal, sir, please unmute yourself.
Thank you, Shaun, and other organizers for organizing such beautiful things. This is a parcel of our clinical practice, and as a surgeon, we are less often involved in the research and publications in different aspects. But most of our research activity are actually guiding the thesis and dissertations of our trainees and junior fellows. So by this way, we can also contribute in the research activities of our country also. First, I want to congratulate Dr. Abdullah Yusuf. I know him for a long period. He's very enthusiastic and he's a very knowledgeable person regarding research. And not only that, many of us has got this, some knowledge about research activities, but a few of us actually contribute to develop the research practices among our teachers, among our students, and among our trainees. Abdullah Yusuf Harun is, of course, an exception. He always tries to encourage others, teaches others, and also to motivate others to come and to involve in the research activities. That's the most important. And today's what he has delivered, he covered in a single session almost every corner of the research aspect. And this is a tremendous job, and this is a troublesome job as well, because in a single lecture of about 1 hour, it's very difficult to elaborate almost every aspect nicely, elaborately, and to the point. So this is very important. Now come to the research activities. Yes, we first of all, we are clinician. The second is we are academician. And of course, the less often we are involved in research activities. That's why surgeons' research activities are a little bit fewer in number in comparison to our medical or in comparison to our teachers involved in basic subjects. But we love research, and in many times when we teach the students and provide some training to others, we always recite the research data and the research activities from the other countries also. So we cannot ignore our research by any means. Now, for the last couple of years, I am involved in the research activity and research training in Registration and Training Monitoring Committee of BCPS. And also I am actively involved. I am one of the member of the National Research Ethics Committee, actually run by the Bangladesh Medical Research Council. Just I want to emphasize a little bit more about the activities of this National Research Ethics Committee, because if I elaborate a little bit about the NREC, that is National Research Committee of BMRC, then many things will be clear how we can proceed to form a research activity, to start a research activity, and to take the helps of the organization like BMRC, ICDRB, even the universities. So National Research Ethics Committee is a 17 members team headed by our National Professor Shahla Khatun. And this committee is furnished with so many different aspects. And you will be surprised to know that two members of parliaments are included in our NRDC. And the other members of NRDC are like a head of the Department of Arabics, Dhaka University. He's not a doctor, of course, but he himself contributed a lot regarding the different religious aspects of research. Another important member is Deputy Attorney General of Supreme Court. So he regularly involved in these meetings and he contributed a lot, whether we are debating any law or we are debating any national issues or national interest as well. And there are many other members like President of the BMDC, President of the Bangladesh Bioethics Society, and presidents of the Pharmacology and Pharmacokinetics Society. And also there are the head chief research physician, all of you know probably Professor Firdaus Kadri of ICD-DRB. She is also one of our proud member. And like this, but interesting thing is that only two member has been recruited from the government service. Other than me, another one is Professor Khan Abul Kalam Azad. He is the principal of Dhaka Medical College. So only 2% from the government service. So this is a quite an independent and very high power committee. And recently we have observed that we have confirmed ethical clearance of one of the vaccines which has been requested by ICDRV to see whether there is an ethical problem or not. That is the vaccine against the COVID virus. And recently we are clearing so many research projects funded by Bill Gates Foundation and funded by various international organizations like Cambridge, Oxford's, and so many places. And you will be astonished to see that not only the medical aspects, we also covered the pharmacological aspects, biological aspects, and biohazards things in our National Research Summit Committee. That means any research in the lands of Bangladesh involves some of the volunteers of the human beings should come through this National Research Committee. And when a project comes to the BMRC for ethical clearance, the committee first sent this to two peer review person to see whether there is any ambiguity or there is any shortcomings of the protocol itself. Then after getting the reviewers comments, both the reviewers comments, if agree or if put some question, they need to be again reviewed by the principal investigators. And after completion of all this process, this research project has been put to the forums of the National Research Committee. And these Research Committee get together, all the members usually present in every meeting, almost every meeting. Every individual protocol, they discuss after reviewing by the two reviewers, every member of the National Research Committee discuss about half an hour of every project. And you will be astonished to see that one of the important member chosen by the director and the chief of this National Research Summit Committee, and they reviewed, the individual member reviewed the protocol 2 or 3 days before submission of that meetings. So this is the way. So by no means there will be any possibilities of hampering any or violating any ethical aspects which has been declared. Abdullah has been mentioned the Helsinki declaration. He has mentioned the blinding process. He has mentioned the Hawthorne effect. So many things. So everything we have to look this, and then with this forum, if we declare that it is acceptable, then the original research. So this is the way. But one thing is that many times the researchers sometimes they get afraid whether my research project, if I put to the BMRC, then there is little chance to get clearance. But with all this process, we reviewed so many things, but very few proposal actually we refused, because most of these proposal corrected, and most of these proposals are we put some suggestions, and after getting those suggestions, most of these proposal get permission. So this is the activities by which the National Research Ethics Committee works. So by this way, actually, we ensure a accountable and good quality research in our country. So this is the way. With these little comments, mainly I just concentrate on the ethical aspects of these research projects. I think other experts or other other panelists. They will discuss the other aspects of this research project. So thank you, Abdullah Yusuf, again, and thank you, the organizer, for giving me the opportunity to discuss something.
Thank you, sir. Thank you for your nice words, sir. Now I will request our foreign faculty, Professor Dr. Shom Prakash Basu. He is the leading academic in India and All India Institute of Medical Science. And I am glad to inform you that he is a Bengali. He is Bengali. So we would like to hear from you, sir. Sir.
Thank you very much. First of all, I must thank Professor Shah to have invited me here. I was wondering, I mean, how come he caught hold of me and then sent me the invitation? But in fact, I was very curious and I was interested to join because I have never had this opportunity to join any forum in Bangladesh, and that to one of my favorite topic, that is surgical research. So that's how it is. Thank you very much. And it was a very nice organization which you have done. And it's a difficult topic. I mean, it's not easy because throughout life we learn actually about research. And I was very keenly listening to all the deliberations by very senior members of the faculty of Bangladesh. And I must say one thing, that to unlearn and relearn is the way forward. Because when we were students, research methodology and technologies, all these things were not very prominent during our training. We had to finally unlearn it and then relearn it. So to percolate this research in Bangladesh among the junior faculty, students, the teachers have to learn first what is the research methodology. For that, I think you must be having a system in place which gives compulsory training for basic training for research in surgical research, because it's slightly different from medical research, and that's how to go ahead. And one more thing is that one such symposium or seminar, if you hold, that will not solve the issue. You have to repeatedly hit about this because it's a difficult area, and that's how you can go ahead and get more paper published in index journals. And once that thing happens, gradually people come into limelight and then go into an international community. I'm very happy with today's presentation. I must congratulate Dr. Yusuf. He did a commendable job, there are very intricacies of things which he took into consideration. And I'm happy to see that people are still interested, young faculty are interested in putting forward this effort towards research training. Thank you. If you need any help from my side, I'll be happy and glad to do that.
Thank you, sir. Thank you very much. Before going to our next panel of expert panelists, we have another question that is asked by Dr. Akhtar Ahmed Shubham to the speaker. We do a lot of surgical works, many innovative techniques in our settings. How can we make our successful steps a standard? Dr. Yusuf.
Thank you. So we do a lot of surgical works, many innovative techniques in our settings. How can we make our successful steps standard? So standard is like you have to do the research work collaboratively with outside country, so you can make it more standardized. So standard thing is not like I am doing this. This is standard. It's not like thing. So when you compare with other countries, where the settings are modernized or like updated, you just compare with those and you can say that this is a standard technique. So you can do the research work with different multiple centers and compare with those centers, then you can say that this is a standard one. Professor P.K. Shah, sir, can you have something here?
Thank you very much. Thank you. First of all, I like to heartful thank Professor Prakash Basu. After inviting, he gladly accepted my invitation, and like to thank the presenter, Dr. Yusuf Abdullah, and analyst for presenting the nice presentation. And his presentation, I think, it will help the younger students to make, understand, and initiate to activate the research work. I think so. And the example is like that. Dr. Shubho already very much interested how we'll start the procedure. I have started the some operation, but in this way I cannot say this is the superior one, this is the best one. You have to compare with the other countries or other institute or other search. You have to compare, and you have to go through a study design. Without study design, without data collection, analysis, interpretation, discussion, and application, you cannot say anything. That's why you have to start the research for first of all thing, planning, and first of all important thing is the hypothesis. What is the problem? You first of all you decide your problem, then you make the hypothesis. Then you have to go for the proceeding. Then that is what should be the study design is important thing. That is why it is chronological matter. If we have to start a pilot project, that will help you. We are always with you. Then we can improve our academic activity as well as the research activity of our country. That is our aim and objective to start the research methodology in the webinar. And I congratulate the learned audience who have spent the more than just like this 2 hours to present here and encourage us to such a webinar to initiate and go forward. With the help of the seniors and juniors, we can easily move forward, and we like to go up to the international standardized. That is our aim and objective. Without research, this is my belief, we are the scientists, medical scientists. That's why each and every scientist always come in contact with the research. Without research, a scientist cannot have the flavor of the work. That's why we are usually done lot of work, but there is no data. This is very much painful. There is no data. There is no importance. There is no operation mode. But I think from this step, we have to proceed step by step. My idea is like another, that is 8 to 10 lecture will be arranged to make it easy, simple of the research methodology for the surgeons to start the activity of their working life and enjoy the flavor of life of the great surgeon. Thank you very much. Thank you.
Thank you, sir. Before concluding this session, we have another question. Possibly Professor Jamal sir will answer it. Is BMRC journal, is PubMed index journal?
Okay, Shaun, thank you for a very nice question. Before answering this question, I want to add some points regarding the question answered by Professor P.K. Shah about the question of Akhtar Ahmed Shubho. He has asked, probably his eagerness is about to do a standard world-class research in our country, in our context. Just last week, I reviewed a research protocol which has been put by Liverpool School of Tropical Medicine. Probably all of you heard the name of this prestigious organization of the UK. So this Liverpool School of Tropical Medicine, they want to see the enhanced self-care protocol. They have developed a protocol of self-care about the lymphedema of filariasis patient. So you know that lymphedema is a common problem and very disgraceful problem of the filariasis patient. So they developed a protocol and covered 3 countries collaboration. That means it's in Bangladesh, it's in Ethiopia, and it's in Malawi. So the protocol has been developed by Liverpool School of Tropical Medicine, and co-investigators from Bangladesh are surprisingly from the doctors or the physician involved in filarial treatment in Lalmonirhat district. You know the Lalmonirhat district is very remote from Dhaka city. So they are the co-investigator of a project, a surgical disease process of course, and it's selected by the Liverpool School of Tropical Medicine. So by this way, by this cooperation, we can contribute a lot in our world-class research projects. So at this moment, if you want to establish in our own setting, a very large and elaborate projects, of course, you will be frustrated after going some months or some years. If you just obtain some cooperation and collaboration, such kinds of international organization or prestigious organization who funded, who help a lot, and who also guide, and who also provide some financial supports as well. So you can just take some collaboration of these kinds of external resources and use a multi-center, center and multi-country studies. So this is one of the way. So now come to the next question. The BMRC journal. Actually, BMRC journal was an index journal, but it's not a PubMed accredited journal. Now Bangladesh has only one. Yusuf has mentioned that the Mamishing Medical Journal, and we will be sorry to say that 3 of our journals has been indexed in PubMed earlier, but they failed to fulfill their continuous requirement and criteria, and that's why those journal has been omitted. I don't want to mention the name of those journals. These are very prestigious journals of very high reputed organizations, but those journal PubMed has been omitted from their index journal. But there are not only the PubMed, there are other index authority also, and BMRC, BCPS journal, NIPSOM journal. These journals are, I mean, even ICDRB journals. These journals are also indexed by some other indexed organization also, not PubMed. There is only one journal index in PubMed, is that the Mamishing Medical College Journal, because that is still today they are maintaining the standards selected by the PubMeds. Thank you.
Thank you, sir. Thank you very much.
Rahul.
Now, yes.
Dr. Mamun. Can I say a few words?
Yes, sir, please.
Thank you, Dr. P.K. Shah, sir, for arranging such a nice webinar on research methodology. Actually, this is the most neglected part. So we surgeons are far behind, because from our country, our medicine colleagues, they have some publications in the world reputed journals. But I don't know how many surgeons from Bangladesh have published their article in internationally reported journal. I don't know anyone. So if anyone, you can just share your article with us. So again, one thing, so we have the Society Journal of Surgical Sciences. So from this year, so I have been just given the responsibility to act as a managing editor. So from today's webinar, I request everyone to encourage you. So just you do your research work and let us know it, submit it for the Journal of Surgical Science and make it standardized, because this is the journal from the Society of Surgeons of Bangladesh. So this is the parent society. So all the surgical society, all the surgeons have the responsibility to submit their works here and make it standardized by working together. So your contribution, our effort, and definitely we need help from Abdullah Yusuf. So he is a very good contributor. He was working with Shoeshwar at the medical college. So Shoeshwar at the medical college definitely will name Dr. Abdullah, because he has a lot of contribution for today's position of Shoeshwar at the Medical College Journal. So again, I want to congratulate Professor Somprakash Bosu So he's a people of this Bangla, so East Bengal, is a man from Joshore. So though he has not yet visited Bangladesh, so I have the opportunity so to visit Varanasi. So the then time he was the associate professor of Department of Surgery in the Banaras Hindu University, and he has shown us lots of hospitality. Few surgeons from Bangladesh we visited in the year 2013 his institute. So we can't forget his hospitality. So again, I must pay my gratitude to Professor Shom Prakash Basu. And I want to also contribute because in the year 2013, I have started Limburg Flap for pilonidal sinus. So he was act as remote mentor for me because I talked to him and I have shared my ideas with him, and he gave me so many suggestions and good advice so how I can improve my surgery. So thank you, Professor Shom Prakash Basu, to be here with us. Thank you, organizer. Thank you, Shaun.
Thank you, Dr. Maun, sir. So we have some another faculties. Here is my boss, Dr. S.M. Kamrurakta Sunju. I would like to hear from him also. Dr. Kamrurakta, sir.
So thank you, Shaun. I'm sorry I'm late, though I was outside, so I can join. So as the late, I entered in the later part of the part. So I'm thinking as because we are lag behind actually, and I should in this time there's a 2 article is published in Elsevier last year of mine actually. So the sum of article and one case report is published in BMJ, British Medical Journal also. So some surgeon has some case report. I think there was not the total research work have been published yet in my knowledge. So we have to come forward and to improve ourselves, and without this publication, actually we cannot improve ourselves. So we are looking forward, and Abdullah is also very known to and close to us, and he helped every surgeon and everybody to publish his medical journals. So I think we have to come forward and enrich us with sharing our publication with each other and with our international colleagues also. So sir, thank you very much, Shaun.
Thank you, sir. Now, I would like to request Professor P.K. Shah, sir, to have a concluding speech, and then we will conclude the session. Sir, P.K. Shah, sir. Unmute yourself, sir. We cannot hear you, sir. Unmute yourself.
Sorry. Thank you.
Sir, please again. It has been muted again. Yes, sir. Okay.
Now, all right. Okay. Thank you, Dr. Shaun. I have enjoyed, I have learned many of things from today's webinar. And first of all, I like to congratulate and heartful thanks Dr. Shom Prakash Basu and our senior teachers who have participated in this webinar. And I also give thanks to the expert analyst and presenter Dr. Yusuf. I don't like to say something regarding the presentation and about Yusuf. Yusuf is itself is an institute, I think so, regarding the research concern. Each and every person come in contact with the research work, come in contact with the Yusuf. This is our hazard. And last of all, I always congratulate and I always thanks to the learned participant. Without the learned participant, these webinars have not possible. That's why, last of all, I like to thanks to the participants also and the moderator Dr. Shaun, he have already very nicely, excellently, I should say, from starting to ending, he completed the webinar very nicely. And nicely, I like to thanks to the ACI Dr. Adnan, who gave the enormous time and the discussion to make it a success. And like to give the thanks to the Raj TV also. And last of all, I like to thanks and gratitude all of the participants, all surgeons of this webinar. Thank you very much. Thank you.
So thank you, everyone. Possibly we will organize more webinar regarding these topics. And also Dr. Abdullah Yusuf will be with us in next many sessions. And thank you, everyone. And with this, we conclude our session.
People like to say something, you have to say.
You can say.
You are watching Raj TV, Jagorone, Bangladesh. Please subscribe.